and welcome to a brand new episode of Meet the Masters. I'm Sonia Das, and today we have with us an accomplished FRCS doctor in Consultant General and Laparoscopic Surgery. He was honoured with a travelling fellowship by the Royal College of Surgeons, Glasgow, which enabled him to travel to France, where he was trained in advanced laparoscopic surgery. Let's welcome to today's episode Dr. Sai Ganesh Pillai, the founder and managing director of Dr. Sai Ganesh Pillai Clinics. Welcome, Doctor.
Thank you.
Doctor, what are the specialities and services offered at Dr. Sai Ganesh Clinics?
See, obviously, I am a surgeon, specialized in surgical gastroenterology. So we have surgery and gastroenterology. Then our strength is in dentistry.
Okay.
We have 3 clinics.
Okay.
We are acquiring 3 more clinics.
Oh, wonderful.
Which are running clinics.
Okay.
So the 3 clinics we are having since 14 years.
Okay.
So these clinics are also being, which we are going to acquire, is also being running for 3-4 years. So we will have more than 30 dentists in all the 6 clinics together. So dental department is our strength.
Okay.
Okay. And apart from that, we have homeopathy.
Okay.
And we have physicians.
Right.
So this completes our team of doctors.
So homeopathy has been recently introduced, or
yeah, in the other clinics, homeopathy has been there since like about 2 years. Okay. But in this clinic, we have added homeopathy last 3 months.
3 months.
Yeah.
Wonderful. So you have won many awards and accolades over a scintillating career. So can you please reveal your secret mantra to our viewers?
Secret mantra, one is definitely you have to have some intelligence. Okay. I always say that it's very easy to deal with intelligent people, you know. Okay. Intelligent people can adjust to different situations. So you have to have intelligence, but intelligence makes only maybe, many intelligent people are lazy. I have seen that way, you know. So hard work is the most important thing. Even if you are not intelligent, you can make up with hard work.
Right.
So hard work and then intelligence.
Okay. What is your outlook of the UAE healthcare sector, and is the market already saturated, or is there further scope to continue starting new facilities?
See, UAE is a very rapidly expanding country. Expanding in the sense, you know, the area is also expanding because there are a lot of vacant spaces where buildings are coming up, infrastructure is being built, and the population also is increasing. Right. If I am not wrong, every year the population keeps on increasing with by 10 to 20%. Right. So that way, definitely when the population increases, you see, healthcare caters to people. Right. So when the population increases, definitely we need more doctors and more facilities in the healthcare sector. So definitely there is scope for more institutions. And technically, I would say that, you know, UAE has definitely, these days all countries, you know, equipments are not an issue. With countries opening up and markets opening up, trading opening up, you can get equipments from any country to, like for example, if something is being invented in Russia or United States or United Kingdom or Japan, you can get those instruments within a short span of time. Right. But there are still, I would say that, you know, the healthcare in UAE is pretty nascent, very young, and it requires little more nurturing and a little more maturing. Right. But definitely we are moving in the right directions. And you know, expertise wise, lot of expertise is coming from lot of expert doctors, expert hands is coming from other countries and beginning to work in this country. One of the reasons is that the pay scale of doctors is very attractive. I would say, in my experience, UAE is one of the countries where the doctors are most highly paid. Right. Some of the doctors are very highly paid in this country, even compared to the Western world. The pay scale in UAE is very good for doctors. So definitely that will attract a lot of talents. But definitely we need more improvement in the basic, what should I say, the the legislations and things like that. But that is moving in the right directions, and let's hope.
So, you have had a great deal of experience working in countries such as England and France. So, how different are the medical practices in the GCC when compared to Europe?
That's what I was, the last part of my answer to the previous question, I was coming to that. There needs to be lot of advance in this country as far as handling the healthcare industry by the decision makers, because health is not like engineering where 1 + 1 is 2. In health, it's not like mathematics.
Right.
So it's a bit of an art also. So when something goes wrong, or when healthcare workers are evaluated, they are evaluated not completely objectively.
Right.
There is a subjective element also. So there needs to be a team of good experts who can evaluate, when there is some maloccurrence, or when doctors are evaluated to begin their work, or even otherwise, when there is an audit, there is something called medical audit. So there need to be for example, doctors also need support. Doctors should practice with great confidence. So for great confidence, the doctors need to have belief in the system. See, in UK and US, these are the advanced countries. Japan is fast catching up, and Germany also. These are advanced countries as far as healthcare is concerned. There, when doctors are evaluated or medical audit is taken, there is a peer review. Doctors are continuously being trained by senior doctors, and they have a system whereby any medical maloccurrences can be assessed. Right. For example, if there is a blood surgery, there is a panel of doctors who are experts in that field, who can evaluate in the most fair and most just manner. So those sort of the systems are definitely being put up in this country also. And once the doctors get confidence in that system, definitely the healthcare sector is all set for a boom in this country.
So what about India, doctor?
India, see, likewise, there is a lot of support, like the Western countries. There is a lot of support in India, but I won't say that it matches the Western system or Western standard. But still, the rules are in favor of the doctors in India.
Right.
Actually, it should not be in favor of the doctors, or it should not be in favor of anybody, the patients or whatever. It should be balanced.
Right.
But in India, the doctors have got a lot of space to work, and a lot of confidence, whereby they can feel supported by the system. Right. So that's why in India the healthcare is developed very much better than the GCC world, because the doctors practice their trade with no fear. Right. With full confidence. So in India, the system supports the doctor, and like I said, the peers also, the people reviewing when there is any maloccurrence, they are also well trained in that sort of situations, or that sort of expertise they have. So that will slowly come into this country, but definitely in India the system is not very well balanced. Yes. I would say that it is balanced in favor of the doctors. Right. It should not be like, but the right blend is in UK or US or even Germany, where it's evenly balanced, not in favor of doctors, not in favor of the system. The system is properly balanced. So we should in the GCC countries, we should aim for some system like that, Western system, where the doctors can get confidence to practice their trade with no fear. That is the way forward for healthcare in this country.
Wonderful. So, how have you been able to cope up with the advancements in technology and implement innovation into the healthcare sector?
There are a lot of conferences happening in this part of the world, especially Dubai.
Right.
For example, Arab Health, all the specialists from lot of different countries. We were discussing before, Western countries is not the only country where latest developments in healthcare is happening. A lot of developments is happening in India, in Japan, for example. Korea is also very well advanced in the medical sector. So all these people, GCC countries, especially Dubai, is well located and geographically also well placed for these people to come and share their knowledge. So by attending these conferences, definitely we get to know what's happening everywhere in the world, and we get the opportunity to meet people who are in the cutting edge of technology, and we can visit their hospitals and we can imbibe their knowledge. So definitely it's a great what should I say, great opportunity to be in this country, so that technically also, not only me, all doctors in all specialities, and they get the opportunity to meet these people, and they can travel over to their country, and definitely the knowledge percolates through.
Right. Yeah. And is incorporating those advancements tough, or is it easy to incorporate? With the UAE standards and laws.
That's what I said. It may be a little tough, but definitely we are getting there. We are in the right direction.
Great. So, what has been the most satisfying moment in your professional career so far?
We cannot say what is the most satisfying. It's like asking a singer which is the best song he likes, or asking a painter which is the best painting. Definitely it's a growing process. I'm still learning. It's a growth process, and I have definitely had many instances, many surgeries which I have performed, which have given me great satisfaction, and also the opportunity to serve the people. So I cannot put my finger on one single thing, I should say.
Okay. Yeah. As an expert, what are the major drain holes in healthcare industry, and what is your idea in plugging these drain holes?
See, as far as this country is concerned, we can't speak of drain holes, because this is one country which drains expertise from everywhere, right? Yeah. This country extracts a lot of talents from all over the world, especially since I said that the pay scale for doctors in this country is very good, very international. So we have a lot of talents flowing into this country, and not only that, nationalities of different nationalities. I think around 130 or 140 different nationalities are there in UAE. So usually, what happens is that people of one nationality prefer to go to their own nationality doctors. That's a general preference. Yeah, that's a comfort zone. Not only relating to their own people, but talking in their own native language. That gives a lot of comfort, because we can explain our problem better in our own language, right? If you are from a part of the world and you are coming with a sickness, you can explain yourself better to the doctor in your own language. So most people get comfort in seeing people from their own part of the world. So because so many nationalities are there in this country, doctors from all these nationalities are also attracted to this country.
Right. So just out of curiosity, you've worked in all over Europe, in fact. So in that case, how come you chose UAE to come and establish your career as an entrepreneur, that is?
That life takes you to different parts of the world, isn't it? It's a combination of factors. It's not that I was attracted. I happened to be in this country for a short span of time. And then I found myself being accepted by this country and the people of this country. So that's how it all began.
Great. And what is your advice for recruiters in the healthcare industry to hire and retain quality professionals?
Like I said, to retain people, definitely monetary benefits are definitely an attraction, and also the working environment. These people at the cutting edge of technology, the latest expertise. When they come with that expertise, they come with a big baggage also. They have their own whims and fancies. So we have to give the correct environment for them to work. To make their work easier. To reduce the red tapeism. So these kind of, if you make the environment right for the doctors, see the doctors, I'm using the word doctors over and over again, but doctors are not the only people involved in healthcare.
Right.
There are other paramedical staff, nursing staff, lot of other staff, even the front office, the front desk people, the back office people, they all contribute. It's a teamwork. So the important thing is to provide the right environment for all these people to work together and to interact together and coexist together.
Right.
Yeah.
So finally, Doctor, what are the impending expansion plans for Dr. Sai Ganesh clinics?
We have a lot of ambitions. We are an ambitious group. I told you we are acquiring new clinics, new projects. Definitely we have plans to expand all over GCC and also back in India. So let's see. Let's keep our fingers crossed.
So would there be very soon a full-fledged hospital?
Why not? Why not? Why not?
Great.
Yeah.
So do you have any message for our viewers?
Viewers, okay. Our viewers are our customers,
Exactly.
should I say. So to them is, I should say that never get sick.
Yeah.
Let's pray to God and let's follow a healthy lifestyle. So that we never get sick, never have to see a doctor. That's my prayers also. Never let nobody get sick, so that nobody have to go and see a doctor. For that, you have to have a healthy lifestyle. Many of the diseases are genetic.
Yeah.
That's why even if you want to, nobody want to get sick, right? But even if you want to avoid sickness, you cannot all the time.
Yeah.
So what we can do is we can minimize the times we get sick, or minimize the diseases which we get. That's one thing. So for that we need to follow a healthy lifestyle. So in healthy lifestyle, the most important thing is the diet we take.
Right.
So now internet is full of all types of healthy diets. So I don't need to recap on that, what to eat, what not to eat. People, it's the information is out there for everybody. So eat healthy, exercise well, and follow a routine of keeping stress away. So whatever meditation or whatever way you can keep stress away, and also for the healthcare industry people, let's give, whenever people get sick, let's give them the best infrastructure and best team and best treatment possible.
Great, great. So thank you so much, Doctor. And with this, we have come to the end of our interview. It was a pleasure having you with us, and thank you so much for your time.
Thank you very much. Thank you for this opportunity, and thank you, Medibus TV.
Thank you so much.
Thank you.